Hi, this video snippet will be about some basic clinical biomechanical concepts. I doubt whether there's very much in here that you haven't heard of before, and you are using some of this, I'm sure, in your clinic. But I think there will be a slightly fresher look, maybe a different perspective that might help you understand what we're trying to do in the clinic a little bit better than maybe you are at the moment. If not, it's a review. If it is, then I'm glad. Concavity and convexity of the joint surfaces is a basic principle in manual therapy. It tells you which direction to mobilize either surface to increase the range of movement in a particular direction. So this is where we'll be going initially. We'll be talking about these surface shapes. Now, immediately our profession has screwed this up again, and we've got completely non-mathematical definitions of what a solar surface is, an ovoid surface, and so on. They're just not mathematically correct. They're almost trivial. They're certainly inaccurate. For example, we class a football shape, the real European football, the real football, as an unmodified ovoid. It isn't. It's a sphere. Even a spheroid that's an ellipsoid is not an ovoid. So the difference between a sphere and an ovoid is that the sphere will cut circles every time you go through it. So a cross-sectional area anywhere in that sphere will be a circle. With the pure sphere, the radius to any point on the circumference are equal all the way around. The ovoid surface, on the other hand, actually is shaped like an egg, which is where the name comes from, oval. And now when you take a cross-section of this surface, you'll see it's oval in shape. And so there are two foci there. So the distances from either one of those to the surface is not necessarily the same. And there is no central point where the surface shape is going to be the same. Now, but we'll go with the traditional way this is talked about, even though it is wrong. Even the English is bad. Modified ovoid is an ovoid. An unmodified ovoid, rather, is an ovoid. If, though, I take the football, in this case, and stretch it out or twist it in a different way, but if I stretch it out, then that becomes a modified ovoid, whereas we're naming the football as the unmodified ovoids. Saddle joints are saddle joints, and as the name implies, it looks like a saddle. So this has a convexity and concavity to its shape, whereas the ovoids are entirely convex or entirely concave. These are concavo-convex. Now, the saddle up there, you can see this. You can see that one curve is going that way and the other one's going over that way. And with an unmodified cellar, those two curved surfaces are perpendicular to each other. If I was to take the saddle and twist it a bit along its length, or twist it this way, then these movement lines, the curvatures, would no longer be perpendicular to each other, and this would become a modified cellar. Now, and I'm going to talk about this again in a little bit. The football will give you 3 degrees of freedom. Basically, if we count degrees of freedom as along the axes of motions, the three-dimensional movements. I know there are other definitions of freedom degree, but in this case, this is where we're going to do this. There are 3 dimensions that we actually work and move in. So this ball can work around the axis in all of those dimensions, but to be independent, the axis has to be perpendicular to the other 2 axes. And that's exactly what it is with the ball, and that determines what movements we can do. So with a football, for example, I can move it this way, over and above that way. I can move it that way, forwards and backwards, and I can spin it. And this gives me the 3 degrees of freedom. The ovoid surface, on the other hand, what you can't do there is you can't spin it. So if these are elongated, I can do this with it, and I can do this with it. What I can't do is do that, because the surfaces jam on each other. So that gives you 2 degrees of freedom. The saddle joint, actually, the unmodified saddle joint is like the web space between your thumb and your finger. So we've got the concavity there and a convexity coming over the top. And if I fit 2 of those together, I can do this movement and I can do that movement. What I can't do if these are rigid surface is twist it and they'll lock on each other again. Now if I twist the axis by bringing my thumb across the palm of it, then I've only got one axis of movement, 1 degree of freedom. It'll move along the axis and it can't go anywhere else. So the modified seller will give you 1 degree of freedom. The unmodified seller will give you 2 degrees of freedom. Okay, this is my attempt at depicting movements along these joint surfaces. On the left hand side are the seller surfaces. The top one is the unmodified seller and the bottom one the modified seller. And the top one, you can see the curvatures are perpendicular to each other, which gives you movements that are perpendicular to each other, and they are movements around independent axes. So this one can move through 2 degrees of freedom. The lower one, though, is a distorted seller joint, so it's been twisted, so the lines of curvature are not perpendicular to each other, and you can't move along either of them, really. So you move along the new single curvature that's available in that to give you 1 degree of freedom. On the right hand side is showing the difference between an unmodified ovoid and an unmodified seller, and you can see what the difference is. The difference is the spin. I can basically think of cut half a football, fit it over the top of the other football, the real football now, proper football, not rugby balls and American football, but soccer balls, if you like. I hate the term, but soccer balls. So it's capable of spinning anywhere on those surfaces. So you can move that skin of the football over anywhere you want to, and that will give you 3 degrees of freedom. Whereas the unmodified seller can only move along either of the 2 movements. So this one has 2 degrees of freedom. Okay, so we're going to talk about movements on the joint surfaces. Now, there are 2 types of movements, spins and swings. Now, a spin occurs when a point on the one articular surface doesn't move across the other articular surface. So I don't know if you're familiar with the concept of mechanical axes, but imagine a point on the bone that's going to be your axis of motion. Now that will sit like so, and it can spin around its own axis. Now there's no translation occurring, and that is a spin. Now if that point actually moves across the joint surface, then it becomes a swing. Now swings can be pure or impure. Now a pure swing has no spin involved in it, whereas an impure swing does. Now the way this works is a joint with 3 degrees of freedom, such as the shoulder. I'm going to have one movement there, just one movement that will be a spin. Now in the shoulder's case, this is proper flexion and extension. That is flexion and extension done obliquely across the body, not elevation and derivation, or scapulation and descapulation, which is a stupid term, but never mind. Flexion and extension, though, you can see this. The point on the shoulder is actually through the neck. This is the mechanical axis of the shoulder. So that point doesn't move, it spins around it. If I do abduction and adduction, as the arm goes up, the head comes down. So you get this translation occurring. That translation is the glide of the joint. If I do lateral rotation, it glides forwards. If I do posterior rotation, it glides medially, glides backwards. So you can only have one spin. Now with joints with less than 2 degrees of freedom, there is no spin available, because it's only a football type of surface, like real football, that will allow this to occur. So you can only have swings. Now in joints with 2 degrees of freedom, you can only have impure swings. Spin has to be incorporated in that. So as it moves across, it's also rotating, because the joint surfaces are dictate that it rotates as it moves across the surface. So you get this impure swing. In joints with 3 degrees of freedom, you can move at least 2 movements that does not involve spin. Now you can't get out of that range. So if I do abduction, for example, if I do this purely in what we would think of as flexion, but at an oblique angle to my trunk there, then I'll get a pure swing until I try to come out of that abduction, and then I'm going to need to lateral rotation to get some more movement. So that then at the end of that range, that no longer becomes pure abduction. It's impure abduction, which is an impure swing rather. Okay, so the relationship of convex versus concave surfaces in the direction you're going to glide the joint in order to regain a movement, a particular movement. So if we look at the top left-hand picture here, we're moving the joint from a vertical position, the bone from vertical position, and we're going to rotate it to the left. Now, when I say rotate, I mean rotate around an axis, not medial or lateral rotation. So the osteokinematic, the bone movement, is defined by the mechanical axis, which is a line that's drawn perpendicular to the articular surfaces. Now, it's not always the shaft of the bone. In bones with a neck, the mechanical axis is usually through the neck of the bone rather than the shaft, but it's a line perpendicular to the joint surface. So this is the mechanical axis in this particular case. So the mechanical axis, that is, the bone is rotating to the left. Now, it means the axis of motion, which is here, is the point about which the bone moves. So everything above the mechanical axis moves in the same direction as the osteokinematic, that is to the left. And everything of the bone below that mechanical axis, including the joint glide, moves to the right. So the overall translation across the joint surface is to the right. So when you're moving a convex surface, the arthrokinematic, the glide, is in the opposite direction to the osteokinematic. So you push the bone to the right to regain left motion. If we're moving a concave surface, though, then it's not the same. There's a mechanical axis here, and we're moving it to the left again. And again, the axis of rotation is still through the convex surface. This bone is rotating around that axis of rotation here. So again, everything above that mechanical axis is moving to the left, and there is nothing below the mechanical axis moving. So in this case, the arthrokinematic is in the same direction as the osteokinematic. To regain that left rotational movement, you would glide the bone to the joint surface to the left. And so in this case, the arthrokinematic is the same as the mechanical axis. If you want to regain spin at a joint that possesses spin, then there is no glide involved. So gliding this bone is a waste of space. So what we'll do is apply the movement, get to the end range of the movement that we need, and essentially put that onto its maximum, and then distract the joint surfaces to get the maximum mechanical effect of the mobilization. Okay, so that's the introduction to surface shapes, articular surface shapes and movements. Probably the most important thing to take away from this is that joints with 3 degrees of freedom have an unmodified ovoid surface, and the movement that can occur in these joints that cannot occur in joints with 2 degrees of freedom or less is spin, articular spin. Now, osteokinematic spin can occur in joints with only 2 degrees of freedom. The knee is a case in point, but arthrokinematic spin can only occur in those joints with 3 degrees of freedom. Also, takeaway is that convex joints, they glide, their arthrokinematic is in the opposite direction to the osteokinematic. So to mobilize a particular movement, you have to glide the joint in the opposite direction. Whereas with concave surfaces, you mobilize it by pushing it in the same direction as the bone movement that you want, as a physiological movement you're looking for. So very basic, mostly a review, hopefully a few new insights, and I'll talk to you soon. Take care, everybody. Bye-bye.